a lot of you guys have been saying, okay, when am I supposed to get a colonoscopy? What's the age? I've seen many of you guys write 50 years old. That used to be the age at which a person at average risk should get a colonoscopy, but it's no longer 50. It's actually 45. That is for a person of average risk, which means they don't have any risk factors that make them high risk for colon cancer. Okay, so 45 years old if you're of average risk. And if you do have risk factors for colon cancer, you very likely need to be screened earlier. If you have a family history, you have certain bowel conditions, underlying conditions, etc. So keep that in mind. 45, okay? It is not 50 for those at average risk. That's very important. But I want to make sure we dispel this myth is that the colonoscopy hurts, that it's painful. The colonoscopy is not painful. Granted, there are some exceptions, right? There's always the rare situation where there's a complication or something like that. But with proper anesthesia, you are not only asleep for the procedure, you also do not remember you've had the procedure. It is not a painful test. You do not come out of the colonoscopy with pain in your bottom, pain anywhere. It is not painful for like the 99.999 or whatever. Okay, that's not an exact number, but for the vast majority of people, granted, I never say never in medicine or in life, but it is not painful, okay, for the vast majority of people. So please do not think that you're going to come out and be in pain. Another thing I've seen people write or ask me about is they were like, well, how long did you have to be in the hospital? Guys, I was let go from the hospital about probably an hour or so, maybe an hour or so after the procedure. I did not stay overnight for my colonoscopy. Now, there may be some situations where your doctor may want to admit you to the hospital to have certain tests done. But for most people, it is not an overnight procedure. I did not stay in the hospital. It was not overnight. My friend came to pick me up to make sure I had a chaperone home because I was still under the effects of anesthesia. I went home, a couple hours. I think I went for my colonoscopy. I had to be there at 11. I think I was home by maybe 2, maybe. It's very quick, okay? Also, many of you guys are asking about the anesthesia. I know there's a lot of people that are afraid of anesthesia in general. I understand the concerns about just sort of being under. A lot of people are concerned about this. I say talk to your doctor though, because it is not heavy. It's not severe heavy. It's not general anesthesia. You don't remember what happened. It's light enough that you can wake up after it's done, etc. Again, you don't have to be hospitalized, etc. So keep that in mind. The other thing I want to make note of is that the colonoscopy, a lot of you guys are saying, how often do you have to have the colonoscopy? Generally, I would say if you have no medical problems, it's probably going to be like every 10 years. But if you have a colon polyp like myself, like my situation, my doctor said I have to return in 5 years because I had a colon polyp that was found. I don't know if you guys probably saw that video. It's on my playlist and in the videos here. Also, some people have to go back though every 1 year, 3 years, 5 years, 7 years, sometimes maybe more than that or more frequently than that, depending on what underlying condition they have. So only your doctor can tell you how often you need to come back. That is something that you need to determine. A lot of you guys are saying, hey, Dr. Jen, I like the prep that you did. Remember the prep that I did was like with Gatorade and with Miralax. That was what my doctor prescribed. And I had somebody write me on social media saying, hey, can you give me the recipe for your prep? I'd rather do that one. No. You cannot just choose to do someone else's prep. Prep is generally decided by the colonoscopist, the gastroenterologist, the doctor who's doing the colonoscopy, and is also likely not only based on the colonoscopist's preference, but also very likely based on your underlying medical conditions and certain things. Not everyone can get every type of prep. So it's not where you just take a look at different preps and see which one you like the best. You need to talk to your doctor about what preps are options for you. The Gatorade prep that I did was what I was advised to do, but I know that many of you guys didn't have to do that, or you did different things. So keep that in mind, okay? And then somebody was asking like how long you have to get colonoscopies. Often the stop age is around 75, but I have patients that get them beyond 75 based on their underlying conditions. It's really going to be a discussion that you have with your gastroenterologist about what you need to be doing, how long you need to be screened, okay? Oh, and the last myth, just to clear up, remember there's more than one screening test that's available for many people. The colonoscopy is a test that, I like the colonoscopy because it's like a one-stop shop. If your doctor finds something wrong, they can retrieve it, they can biopsy it, they can do it all there because they're already inside your colon. There are Cologuard tests, which are like other stool-based tests. Oftentimes with those stool-based tests, even though they're very good tests, if you have an abnormal result, you may still have to undergo a colonoscopy. And for what I'm learning, if that's the case, your insurance may not pay for it as a screening test because it's no longer screening. It gets into the weeds a little bit, but my point being is you just want to talk to your doctor about the risks and benefits of each test and which one's going to be best for you. Some people will not be eligible for a stool-based test like Cologuard or any other tests, okay? So you just got to talk to your doctor, but no, like if you're like, I'm not doing a colonoscopy, no way, Jose, just know that there are other tests that you can do. So don't feel like I'm not going to do anything because I don't want to do that, okay? So those are some common myths that I saw many of you, not maybe necessarily many of you, but I saw some people writing on my posts and on the comments of the videos that I wanted to address.